Hi guys, my name is Dr. Dan Sechiunga.
And I'm Dr. Job Odochi.
Welcome to SEDOC Health,
Ask the Doctor.
We've opened this channel for you to bridge the gap between you and the doctor. Like we have introduced ourselves, we are professional doctors. We are based here in Nairobi. We are coming to you to bridge the gap between the doctor and the patient. We want to come to you at the comfort of your sitting room and the comfort of your bedroom. So we discovered that patients tend to have a lot of questions that you probably are unanswered and probably fear to go to the hospital. That's why we thought maybe we can have this platform.
SEDOC Health is here to bridge that gap, to make the community healthier, to make you healthier. You know, living a healthy life is very important, and we are here for that, answering every kind of question as long as it pertains to your health, lifestyle, exercise, whatever, as long as it's helpful. So there are a lot of questions that are asked. Daktari, just one day ago, a couple walked into my small office consultation room, and they were not sure. Why? Because they thought they had a sexually transmitted infection, and both of them were very furious with each other. And surprisingly, they also thought maybe it's a urinary tract infection. So, Daktari, tell us, how can we identify a urinary tract infection? How can we identify a sexually transmitted infection?
Thank you, Doc. Okay, the difference between the UTI and STI will start from the name first. The UTI stands for urinary tract infection. STI stands for sexually transmitted infection. The urinary tract infection is found in the urinary tract. Now, in our bodies, we have what we call the urinary tract system. So urine is made through that urinary tract system. Blood goes through the kidneys. Kidneys are some organs found almost at the back of your body. Okay? And they help in filtering the blood to form urine. Now, when they form urine goes through some pipes, we call them ureters. And those ureters take the urine to the bladder, urethra, which now transports urine from the bladder to now the outside. Now, any part of that urinary tract, once it gets an infection, that's called a UTI, as opposed to the STI, which is found in the genital organs. So the genital organs, say for example, the female, are the vagina, are the cervix, the uterus, the fallopian tubes, and the ovaries. Okay, so any part of that system, once it gets an infection, right from the ovaries to the fallopian tubes, to the uterus, to the cervix, to the vagina, or even to the external genitalia called the vulva. Once it gets that infection, it's called the STI. Basically, the difference is that UTIs are for the urinary tract and STIs are for the genital tract.
Okay. So, Daktari, talking of that, now, how will someone know that they have a urinary tract infection vis-a-vis a sexually transmitted infection?
Before I go to the differences, we also have cross-cutting symptoms between the two, and probably that's why your couple was almost fighting, because yes, you can have some symptoms coming as a UTI, but also the same symptoms can be for the STI. But symptoms of UTIs are usually burning urination, are usually frequent urination. You find you've gone to the toilet, you've peed, but you feel after 20 minutes, 15 minutes, you still feel like you want to pee again. Sometimes painful urination, sometimes blood in urine, if the infection is really a lot. Sometimes you can have a fever, shivering, some people even have vomiting. Okay? So those are basically the symptoms of the UTI. You can also have low abdominal pain or back pain. Yeah, basically that's a UTI.
And then, Daktari, one common thing, will a UTI present with an abnormal vaginal discharge?
UTIs do not present with discharges. Once you see a discharge, be sure that is an STI. That's a sexually transmitted infection. STIs basically present with, they can also prevent with painful urination, but usually there will be a vaginal discharge or a penile discharge. So they can present with discharges, genital discharges. They can present with painful intercourse, or pain while having sex. They can present with low abdominal pain. They can present with with of course fevers as well, abdominal pains. They can present with genital ulcers, or what we call genital wounds. You find maybe a man, you have wounds around your penis, or a lady, you have wounds around the vagina. Yes.
Okay. So now that you have talked about the two differences, what could be causing this urinary tract infection? Because at least the sexually transmitted infection, we know that it's purely sexually transmitted, unprotected sexual intercourse.
Yeah.
Now, with a urinary tract infection, what would predispose someone to have it then?
Yes. Now, for UTIs, risk factors for getting UTIs, one is being a female. The way God created the female system is that the urethra and the anus are very close to each other. So bacteria, about 80%, meaning out of 10 times, 8 times, someone getting a UTI is because bacteria has moved from the anus to the urethra. We usually see these UTIs, like I've said, in females because of the distance I've talked about. Also because the females tend to also have a shorter urethra. Urethra is that tube that connects the bladder to the external opening of the urine. So because it is short, bacteria will easily move from outside to the inside, and therefore they will get UTIs. Other things that will cause you probably to have UTIs, of course, poor hygiene. And poor hygiene here, I mean, for example, ladies, you find that the lady has gone to the toilet and she's cleaning herself up and down. You find yourself, as you're cleaning, wiping up and down, you move bacteria from the anus to the urethra.
There are some myths that when you continuously urinate, bacteria will rise through the urine stream and come to you.
No. It is not possible that bacteria can move from that pouch, wherever you're urinating from, back into. It is not possible.
So it is not transmitted by air, okay? Maybe by contact with an infected surface.
Yeah.
Right?
Yeah.
Okay. So you have heard it all. So now, Daktari, what are the things that we need to do to prevent us from getting these urinary tract infections? Just I know you have talked about some, but now just give us a clue. What are the things we need to do?
All right. Like I said, that 80% of urinary tract infections are spread by bacteria moving from your anus to your urethra, and that is seen in females. However, there's some 20% which usually is believed to be moved through the bloodstream. For example, you have a bloodstream infection, it is too much, and eventually some of it spills into your urine. However, that is not very common. The commonest is the one where bacteria move from the anus to the urethra.
Or from a dirty surface.
Into your urethra. Basically, that is the major cause. So how to prevent this? One is hygiene. I've just noted that for ladies, once you go to the short call, you've gone to pee, you need to wipe yourself. Once you're wiping yourself, you wipe from up, down, you throw the tissue. Up, down, you throw the wipe. Up, down, you throw the wipe. Once you try to do up and down like this, when you go down this and stroke up again, you move the bacteria from here, the anus, back onto the urethra. So now that becomes a big problem. The other thing is taking a lot of water, because the science behind it is that once you take a lot of water, you're going to fill your bladder over and then. And so once you fill your bladder over and then with urine, you're going to be peeing all the time. And once you pee all the time, you kind of flush out these stagnant, let me call them stagnant bacteria in your bladder. But now for a person who does not take their water, you're going to be there with your urine stagnated into the bladder. The bacteria is going to multiply, and by the time you know, it's going to have spread to probably the bloodstream, probably to other parts of the body.
And remember, urine is a culture medium. Whatever is in urine, bacteria likes it, so it will multiply and multiply. And then to add on that, Daktari, maybe I can chip in. Hygiene, like we have said, especially for the ladies. Panties. We hope that everyone can access cotton panties, because that is what we advocate for. Cotton can absorb sweat, okay? And then besides just using the cotton panties, maximum 12 hours on that panty. wash it, dry it in the sun, and then iron it. That's why it's cotton. And besides that, our urinals, our toilets, make sure you clean them every day. There are a lot of antiseptics you can use. The common ones in the market are like Jig, detergents like Omo and others. And then make sure that whenever a toilet is used, a urinal is used, it is flushed and cleaned. So this would really help us, okay? And then the biggest factor here comes now in public toilets, Daktari. This is where a lot of people get these urinary tract infections from. So when you're in a public toilet, helping yourself, try to avoid contact as much as possible, especially with the surfaces. If possible, you can even clean the surface before you use it. This will help us.
Yes.
Thank you so much, Daktari. So now, we have talked about this and how to prevent it. But now the big question is the urinary tract infection is there, or you may be having the symptoms you have talked about. When is the right time to access a hospital, a healthcare facility for further management?
Thank you. Once you realize that you have symptoms of a UTI, you can try to take a lot of water. That first time you feel it, try to take a lot of water. Like I've said, taking a lot of water will help you flush out the bacteria. If you find that you're not getting relief after trying that, it is better to see the doctor. Go to your nearby clinic, go to your nearby hospital, contact us, we shall be able to help you.
Yeah, so we have had it all, okay? Urinary tract infection, difference with the sexually transmitted infection. So, Daktari, final remarks.
Yeah, in a nutshell, urinary tract infections are not sexually transmitted. Urinary tract infections do not have discharges. Treatment or prevention, take lots of water. Once you realize you're not getting any better, kindly come to the hospital.
Thank you so much, Daktari. That has really been a good one. So look forward to such content, okay? We are here to answer those questions. We are here to ensure that you are living a healthy life. Remember, ask those questions in the comment section, okay? Remember to like this video, subscribe to the channel, and get notified by clicking that bell icon. Thank you so much. This is Sedok Health. Ask the doctor.